So in this final section, I'm going to just spend some time about addressing the barriers to exercise that rheumatoid arthritis patients might actually face. Now, you as a healthcare practitioner have an extremely important role in ensuring that patients with rheumatoid arthritis and other chronic diseases engage with exercise. Now, we know that doctors and studies have shown that doctors can have the most powerful impact in eliciting behavior change. However, there is a problem. Now, there was a study published in The Lancet a couple of years ago that showed that in 5 years of medical school training in the UK, doctors only receive, or medical students only receive, the equivalent of half a day's knowledge about exercise. Just half a day. Now, they receive a lot of knowledge about pharmaceutical treatments, but not exercise for treating and preventing chronic diseases. So as healthcare professionals, we've got to work together to try and address this problem. And there's a number of things that we can try and do to make this easier. The first point is to familiarise yourself with the exercise guidelines for clinical populations, for different clinical populations. Now, in the description to this video, I've put a link to the American College of Sports Medicine's exercise guidelines for testing and prescription. It's an excellent resource which contains all of the necessary information to prescribe exercise for different clinical populations. And I've also put a link to Pedersen and Saltin's research paper, which has up-to-date scientific knowledge about kind of incorporating exercise for different populations, including rheumatoid arthritis. The other thing that a healthcare professional can actually do is facilitate links with sports science departments. Okay, so sports science departments often have professionals that are involved in rehabilitation. They have equipment and resources. So it's very important that you establish or collaborate with these institutions so that you can use their facilities and resources and you can get patients to their rehabilitation suites. Quite often, a hospital may not necessarily have the resources that a well-funded university rehabilitation suite might have, so it's very important to consider that when you're in this kind of environment. Also, find out where your local exercise referral centre is and make that pathway and establish those pathways. Now, in the UK at least, there is a bit of a postcode lottery in terms of exercise referral centres. Some places have an excellent system of referring patients for exercise, whereas other places it doesn't exist at all, and patients are just in a limbo. There's nowhere for them to actually go in terms of a structured exercise program. So if you happen to be in a place that doesn't have a referral centre, as a healthcare professional, you've got an opportunity to set one up, and you can liaise with other departments and other healthcare professionals to get something going. To be able to do that, you obviously need to have a team of people. So you've got to make sure that you liaise with other allied healthcare professionals, so physiotherapists, occupational therapists, dietitians. You need to think about people that are involved in counselling, so psychologists as well, exercise physiologists, those people that are involved in cardiac rehabilitation, doctors, of course, as well. So creating that team of people and getting them to invest into this idea of having an exercise referral centre is extremely important and a worthwhile thing for a healthcare professional to do. Now, we know that in a normal kind of consultation, a doctor has 10 minutes with the patient and they've got to discuss a million other things. So exercise is very rarely discussed as part of that very busy consultation. So one way to overcome that is to actually arrange coffee mornings or have like monthly talks or monthly walks where you can actually get patients together that have a similar condition. They can talk to each other. You could get an external guest speaker to come in and speak. You could perhaps use some of the allied healthcare professionals to come in and talk to the patients. So it's about creating that atmosphere and that environment and that infrastructure to address some of the most common barriers for exercise in chronic diseases.